Okay. So, welcome everyone. I'm excited to be hosting this, and I'm grateful that so many people have turned up. But yeah, so my name is Daniel. I'm one of the GCSE science tutors at EmpowerOwl, and I'm going to be hosting the Dentistry and Medicine workshop. I just quickly want to see if I can. I'm just sorting out my screen quickly. Okay, so I have a few things to get through in this introduction. So firstly, I want to know more about you guys. So how many of you are here looking to pursue medicine? Just say, or dentistry, and then how many of you are unsure? So put medicine or dentistry or unsure in the chat. Wow, everybody's medicine so far. I think that's everyone then. Yeah, so it seems like everybody's medicine. Okay, well, I was looking for some more dentistry. Can you guys see the chat over the screen, by the way? Hopefully, yeah, that's good. Yeah, because you wanna learn about as many of them as possible, as much as possible about both of them. But yeah, let me continue my introduction. So yeah, my name is Daniel. I'm a GCSE science tutor at EmpowerOwl. I'm hosting the Dentistry and Medicine workshops, and I'm a first-year dental student at Cardiff University. Now I'm hosting this for both dentistry and medicine because I personally know quite a lot about the application process for both of them. And I was confused between both of them. I was on the verge of applying for medicine, but I didn't really know what I was doing, to be honest. And so I got loads of work experience in both. I worked on my application as if I was going to apply for both. And so I know quite a lot about both of them. In terms of EmpowerOwl, we are a social enterprise that's dedicated to providing high quality services and high quality education and mentorship at low prices. And the values in which form the core of this organization is to provide education to anyone regardless of their background or ethnicity or household income, and to do that at the highest standard that we possibly can. So yeah, that's EmpowerOwl. In terms of our social media, so there's our social media. So you've obviously got our Instagram, LinkedIn, TikTok, Twitter, and our website. So if you're interested in our tutoring services, you'd head to our website. Our Instagram has got loads of information being there. I think they're posting almost every day, if not every day. Just tips for any student, no matter how old you are. I'm guessing most of you guys don't use LinkedIn yet, but TikTok, I'm sure you guys definitely use TikTok and maybe Twitter as well. Can I know what year you guys are in? Are you guys like mainly in year 12 or year 13 or year 11? Just for year 11, okay. 12, 11, 11, nice. Nice, okay. Yeah, so, oh wait, yeah, now I'm confused. Okay, so some of you, I'm guessing all of you are going into year 11, or some of you, if you put year 11, you're going into year 11. And then some of you are going into year 12. Okay, so yeah, so you guys have made a really good decision to come for and listen to or be a part of these sessions, because you're going to learn so much about these professions. And the most important thing you can do if you feel like you have a slight interest is just to learn as much about it as possible and to get advice on it. But I should also say, as part of the introduction, that if you attend all 4 sessions, you'll get a certificate of completion. And you might be wondering, okay, it's just a certificate, but Those sorts of things can be mentioned on your personal statement, and you can talk about it in your interviews as well. It's really beneficial to you, and it gives, I guess, proof of you doing this and showing a commitment to learning more about this field, basically. Because really all they want, this whole application process, all they really want to see is that you're just committed to it. And the best way to show that commitment is just to teach yourself as much as possible. But yeah, we'll get into more of that later. So let's go on to the first slide. Okay. I need to move some stuff because I can't actually see. This is going to be an hour long. Oh. I can finally see my mouse. Great. Yeah, so this will be an hour long. Deciding your career path. So we'll start off with a simple question. What is a dentist? What is a doctor? I'm sure you guys both know that, but what is it like? Obviously, I'm not a qualified dentist yet, but I have experienced a lot, both in terms of dentistry and medicine. And I can say that any career in healthcare is extremely or deeply rewarding for the right individuals. So it depends on your character, what you're looking to, well, I guess just what makes you feel happy in life and what you're willing to commit your life to, because dentistry and medicine, these are lifelong commitments to learning and education and serving others. And although it sounds long, it doesn't feel long because you're enjoying that process so much. Let's see, what else do I want to say? Yeah, so our job is to provide the highest standard of care that we can for our patients. This job combines science and obviously interpersonal skills. And if you're, as I said, if you're the right individual, those two things will just have you really strongly drawn towards this career. For me personally, in terms of the difference of them, for me personally, dentistry was a lot more rewarding. So I did my work experience both in the UK and abroad with a company called Gap Medics. I think they've changed their name now, but I did the work experience in the Dominican Republic for dentistry and medicine. And then I did dentistry work experience in the UK. And the difference between them, dentistry obviously is academically intense, requires you to really enjoy your sciences, love learning about the human body. And when I say sciences, that doesn't just mean biology and chemistry. There's also so much physics involved as well. So if you've heard of human physiology, that's basically the physics as well of the body. And yeah, you just have to really be a sciencey person, but someone who's, I guess, academically strong. But that combines that science with that interpersonal aspect of helping others, as well as an artistic and creative element. So medicine will just have that science and interpersonal aspect without the creative or artistic flair that dentistry has. So yeah, it might sound like I'm being biased as well when I'm talking about dentistry and medicine, but it's just, I guess it's just my opinion. And the best thing you can do is get as many opinions as possible so you can learn as much about every field. But yeah, so those are the differences. For me personally, I found dentistry a lot more rewarding than medicine. I loved them both so much. But dentistry just had like a slight edge over medicine because the main difference in terms of what was drawing me towards this career was helping others. But the way in which you help people through dentistry is different to what you do in medicine. And you'd understand what I mean when I say that you're able to develop long-term relationships with your patients, whereas in medicine, it's quite short-term. So you'll have like a ward full of patients, and after maybe a couple of weeks, all of those patients would be gone, and you'd have a new set of patients. And it's like you're just meeting new people constantly and helping them, and you never see them again. Whereas with dentistry, you can have a single patient in which you would work with them for a few years in maybe just in general dentistry or like regular checkups, or if that patient has a particular goal that they wish to achieve, you work with them through that to help them achieve that goal. And so it's a long-term relationship, and yeah, it's just a deeper connection. For me, I feel like the work that I do or would be able to do through dentistry would be more rewarding for me, because I feel like the effects in which I have on that person is a deeper effect, a much larger effect on their journey. And that's what made me pick dentistry over medicine. So I think I covered almost everything. Yeah, so you might be wondering why dentistry is separate to medicine. The reason for this is just because, well, it is quite complex. Dentistry is just a specialty of medicine. So you specialize in the oral cavity. And really, I feel like the reason for this is because people didn't start prioritizing their oral health until quite late. They didn't start educating themselves about this. And when people had, I guess, I'm not sure what year this would have been in, but when people had started learning about healthcare, they'd focus on the body mainly. And that meant oral health was quite far behind. And so they created a separate dental or separate school in which focused on oral health, almost to like catch up and provide, so that they'll be able to provide the same quality of care for both the rest of the body and the oral cavity. But the oral cavity is also really complex, intensely complex. And it's like we're starting, so like for the first 2 years of dentist or dental school, it's like medicine, but then we go straight into specializing. Like a medical student might graduate from med school and then specialize in a certain field of surgery. We're basically just really, really highly specialized within the oral cavity because it's just really complex and it requires that attention to detail, that level of detail. How long will it take me to become one? Very long. Depends what you define as becoming a dentist or doctor. If you're truly attracted to this profession, you wouldn't be motivated by an end goal of maybe being able to call yourself a doctor or being able to call yourself a consultant. It's the process. That's what we're all really in for. The process in which involves us learning about the sciences and us also helping people. That's what drives you every day to want to, or that's what drives most people every day to want to continue doing this. So we don't really have any long-term goal, but it does take a long time to reach things like consultant, doctor. So obviously it's 5 years of medical school and 5 years of dental school. You graduate, then you can go into some sort of specialty training. Well, actually, no, it's foundation training. So for medicine, you have FY1, foundation year 1, and FY2, foundation year 2. For dentistry, we say DFT, so dental foundation training. That lasts 1 year for us. And then after that, you can go into specialty training and basically work your way towards a specialty. Now, for med students, you guys, as soon as you graduate, you get the title of doctor. I'm not sure what it's like for dentistry. I think we get the title of doctor, but I'm not sure whether we have to specialize in something else or do something on top of that. But yeah, that's all I know about it. I've got a few more slides going into more detail about that. Next question. What should I be doing if I'm interested? So in the introduction, I mentioned learning. I feel like if you guys are on this course, I guess, or workshop, you've made an amazing choice. And that's the sort of thing you should be doing if you're interested, just taking every opportunity that you find or that you feel like you can have to learn more about the profession. Because through learning, you might start off feeling like, oh, I don't know if this is right for me, but you'll learn more and more about it. And eventually, you might discover that you're actually quite passionate for this and genuinely passionate for it. And that passion is what will carry you throughout this application process, which can be really exhausting and mentally draining. How do I know if this is right for me? Work experience is the best way.
Daddy won't share.
Okay, one sec. Others just coming. Okay, so where was I? I was talking about learning. Yeah, so learn as much as you can about all of this. And if you want to know if this is right for you, work experience is the best way. For me, as I said, I did work experience in the Dominican Republic for medicine and dentistry, and I both found them so rewarding. But the things that I saw in dentistry, that one-on-one interaction was really what drew me towards it and what made me want to pursue it further. So yeah. Okay. Let's go on to the next slide. I've got some more slides on this as well, but yeah, the journey for becoming a doctor, as I said, it's a long one. Medical school, foundation training, and then you've got your specialty training afterwards. You would have to know this in terms of your application, in terms of what you need to learn. Learning the route and having a deep understanding of the journey into becoming a doctor is really, really important. They often ask you questions like this in your interviews, and it shows how well committed you are, because if you understand how long it's going to take to reach, say, if your dream is to be a neurosurgeon, if you know how long it's going to take to be that before you come to an interview, it shows that you're unshaken by that, basically, and that you're really deeply committed to this profession, and that's what they really want to see. So yeah, I've got quite a lot of notes on this. So, and seeing as you're all mainly med students, before I actually go into it. So, okay. So you've got medical school that lasts 5 to 6 years. So some universities like UCL, Oxbridge, those are the only ones I know of. They do a 6-year course, and some other universities as well. They do what we call an intercalated course. An intercalated course is where you can take a year out of the degree. So I know a university like maybe King's or Cardiff, you can take a year out and learn about something completely different to medicine, and then still come back and graduate with a medical degree. So that's medical school. You finish that, and once you finish, you're not yet a licensed or you're not yet legally allowed to practice as a doctor on your own or without supervision. And so that's what your foundation training is for. You basically get a good grounding of everything within medicine, clinically related, to prepare you for what you're going to be dealing with, I guess, later on. And this is all supervised. So you'll have a supervisor who guides you and who you'll be probably meeting with quite frequently. And overall, yeah, just developing your clinical skills within the hospital, giving you a good foundation. Once you do that, you're then allowed to practice as a doctor without supervision. Now, next, this next part is called career pathway divergence. So this is where you start to focus on what you want to specialize in. Now, there are some people who will finish medical school and want to know straight away what they want to specialize in. And they would go into run-through training and just enter their specialty training like that and end up as whatever they aspire to be. I can't think of any specialties off the top of my head. Maybe psychiatry or maxillofacial surgery would definitely be one. If you know what that is, that's where you do dentistry and medicine, and then you become a surgeon of the head. Core training, there are different types of core training. Core training is mainly for people who aspire to pursue, say, if you wanted to do surgery, you'd get core surgical training that would last 1 to 3 years. And that will give you, I guess, a basic grounding of surgery before you go on to specialize in whatever field of surgery you want to. So you could be a neurosurgeon or a general surgeon or orthopedic surgeon, those sorts of things. So you'd have to get your core surgical training done. And that can be quite intense. You're basically, during your core surgical training, getting a bit of a taste of every field, and you're able to choose what you're getting a taste of. But some people who don't know what specialty they want to go into for surgery, but they know that they want to end up as a surgeon, will just get a bit of a taste of everything. Whereas some people who know what they're doing and or know what they want to specialize in will do core surgical training for just 1 year, and then they will go on to their specialty training, which lasts 3 to 5 years, sorry, 3 to 8 years. So yeah, okay. Yeah, I think that's everything. And then GP training as well. If you wanted to be a GP after foundation training, you just go for that. Okay, next slide. So this links back to what I was talking about when I said, how do I know if this is right for me? So these are the traits of, or the general traits of any healthcare professional, really, or specifically in dentistry and medicine. So academic excellence is an absolute must. The reason for that is not to discourage people who feel like they aren't academically capable, but is to remind them that the course is really intense, and it will just, yeah, it can get really draining unless you know what you're doing and you know how to handle that sort of academic pressure. Obviously, the detail of knowledge in which you need to have of the entire human body is going to be, I guess, really immense. And so you need, as I said, you need to be able to handle that well. And so that's why academic excellence is one of the most important traits or key traits of any person in dentistry or medicine. Detail-oriented and artist approach. So this is for dentistry, but will also definitely apply to people who aspire to be surgeons as well. As a surgeon, you definitely want to be aiming for an aesthetic result. If you were to think of things like sutures, for example, you want to be able to be just really detailed and have a good manual dexterity as you're doing those sutures to reduce, I guess, or create an aesthetically pleasing result for their scar after that surgery. But you wouldn't have to focus on that until maybe later on down the line if you're still planning to be a surgeon. Comfortable with close patient contact. So yeah, one thing I should say about these traits is that you may be looking at them and thinking, oh, I don't feel like I have any of these, but these are also things you can develop. As long as you feel like you want the person that you aspire to be is someone who has those traits, it's something that you can develop within yourself. So being comfortable with close patient contact. When I was first looking to pursue, at the time, medicine, I'd never been in contact with a patient, and I was definitely very, very awkward with every new person I met. But then I did my volunteering, and my volunteering was on a ward. I was meeting patients, like new people, like every single week, and it was amazing because I got to speak to them, and I learned just about how much they enjoy being around people, and it got rid of a lot of the nerves I had, or that I thought that I had, because I felt like I wasn't someone who was a social person, but being around those people and exposing myself to that environment, I learned that I was. So some of you might be feeling like, oh, I'm not very much comfortable with people. You have to try it first and see whether you can actually evolve into that person. Timekeeping skills. You know what that is. Me personally, I definitely was not a very organized person at the time of before I got into dental school. But once I got into dental school and I saw the pressure at which they were putting on us, yeah, I changed very quickly. All of a sudden I was like, every morning I'll set up my day and plan out everything I'm doing by the hour because I have to be really organized. And with dentistry, organization is just quite a bit more important than in medicine, because as dentists, we have to work to a really tight time schedule. Each appointment needs to be slotted in almost perfectly. We need to get that done within maybe 20 to 30 minutes if you want to get paid correctly, or if you don't want to end up canceling other appointments down the line, leading to a loss of profit. So yeah, you have to be really, really organized, and dentistry can be a lot more stressful in that way because you're having to maintain that pressure every single day when you're coming into work. Okay, personable, have empathy for patients and can build rapport. So that's something that, again, you develop when volunteering or maybe working in a care home, or even if you don't have the opportunity to get that, if you're just like working in a shop or yeah, just working in a shop and meeting people, you'd be able to tell whether you enjoy that. That's the key thing. It's like, if you enjoy doing that, then it shows that you might actually really be well suited for this career. Stress management. I feel like it's difficult to yeah, I feel like it's difficult to describe whether you're good at handling stress, but you'll deal with that when you get to university. I feel like if you can, the biggest stress you'll have to deal with before you get into med school would be your A levels or your GCSEs. And the results from that are quite reflective of how well you're able to handle stress. So yeah, just I guess look at your GCSE results and how you felt like you coped with the pressure then and how you then performed after that. Commitment and passion for the career, that's quite self-explanatory, trustworthy and honest. Again, ability to follow regulations. I feel like anyone can do that if they choose to, can work in a team. For me, what showed me whether I could work in a team, genuinely, my experience with DOV, I don't really have many team experiences before I got into university, and because I wasn't really much of a sports guy at school, and so DOV was that main area, that main thing that showed me how much I enjoyed working in a team. And how I felt like I was good at it. And then strong scientific ability. If you enjoy your sciences, then you're likely to be pretty good at med school. So, okay, why I chose dentistry. So a lot of people think that dentistry is all about the money, or people think that if you go into dentistry, it's because you're more motivated by the profits, and that's not true. Because they can tell that kind of stuff at the interviews, and dentistry is really, really difficult in the way that it will weed out anyone who's motivated by money and not those who have a genuine passion for what they're doing. Because when those hard times come, that's when people like that will begin to really struggle. Most of the people you'll meet when you get to university, if you're in dental school, they will be just like you, and they will have a deep passion for what they're doing. So yeah, me personally, I'm really motivated by helping others on whatever journey they ask me to. I'm pretty interested in what we call, especially called restorative dentistry. So a patient presents himself with a disease in the mouth, and you basically have to find a way to help alleviate them from the effects of that. Basically just go on a long journey with them. You've also got aesthetic dentistry, where a patient may come in with teeth or the appearance of their teeth, in which really affects their confidence. Again, you can help them with that on a long-term journey. And it's those sorts of things that are really rewarding for me, that interaction with the patient. Those things, that's what drives me the most and pushes me to want to provide the highest quality of care I can. So yeah, the applicant, oh, I should also say, if you have any questions, please just put them in the chat. I can see the chat, but if you have questions as well, you can just unmute yourself if you want to, but there will be a Q&A at the end. So yeah, you can wait if you feel like it. The application process. Yeah, the application process is something. It's definitely going to be the most stressful period of, I guess, academically related of your life so far. I feel like it was definitely a lot more stressful than my A levels, the application process. And the reason for that, they designed it to be that way to weed out people who aren't truly motivated by this career or pursuing this career. Yeah, and so they've made it as difficult, I guess, as they can, because I don't really know how else you can make this a lot more exhausting for another student. But the problem with the application process, or the most difficult aspect of it, is how isolating it can be. This is from personal experience, especially as I'm doing dentistry. Like there were like maybe one, it was like one dentist every 3 years in the school that I went to. And so it was completely isolating. And medical students as well, you'll feel that as well, because everyone in your year is going to be, the application process will just be so easy. You know, they have to write a personal statement. They can waffle if they want to. They can tell lies and completely exaggerate things, because they're never going to see the person who read their personal statement in person, and they're not going to have them ask them, oh, tell me about this part of your personal statement. But yeah, so the process is difficult and it's isolating, and you have to embrace that difficulty, be aware of it, and be aware of the fact that it's just a test to see whether you're really committed to doing this. I feel like it's this sort of pressure that you feel when you're doing your application. It's similar to the kind of pressure that you'll be feeling when you're working and when you're at university. And if you're able to handle that pressure and perform well and hopefully get an offer, it shows that the interviews can obviously see that you're very much capable of working in that profession. So yeah, you can see the steps. So this is exactly the same for dentistry. So you decide whether it's right for you, and you do your GCSEs, do your A-levels. Mine wasn't quite like this. In fact, you can have a read of it yourself. I'll tell you about my one. So for me, as I said, I wasn't sure of whether I wanted to do dentistry or medicine up until like a few weeks before my application was sent off. So I was preparing for both, and I was doing work experience for both, and I loved them both so much. So after my GCSEs, I got the results. I got really good grades, and I was like, okay, I feel like I can definitely go on to do medicine or dentistry. And so I started working towards that. I attended loads of lectures and seminars like you guys are doing, which is really, really good. And I learned so much about the field, and I became really deeply interested in it. Starting year 12, I was focused on my A-levels and getting the highest predicted grades that I could get. So that's what you want to be doing if you're going into year 12. You want to be trying to get the highest predicted grades you can get and just focus entirely on your A-levels, because those predicted grades mean like everything in your application. But yeah, I worked really hard towards that, got good predicted grades. And then in my summer, I went on to do my work experience abroad. Did work experience in the Dominican Republic for 2 weeks, 1 week in a hospital, 1 week in a dental practice. I loved them both. And then I came back and I went on this mentorship program. You might have heard of Medic Mentor. I went on that, and they helped me with my application. It was kind of like this. It was a series of sessions, and we went through every aspect of the application. And at the time, I decided that I was going to focus more, I guess, strongly on dentistry. And so I wrote my personal statement in the summer, and then I sat my UCAT, and I got all of that done, and then I sent the application off. I didn't do the BMAT. There's only one BMAT university for dentistry, and that's Leeds. All of mine were UKCAT. So I did that, and it all went well. And then I got my interviews, prepared for my interviews, and did that, and I got three out of 4 offers for dentistry. So yeah, that was my application process. But back to that isolating part, yeah, learning about all of this by yourself is isolating. It requires a lot of independent learning, and you just have to accept that. When you're feeling lonely, when you feel like giving up because you can see your friends, their application process is so much easier than yours, that's when you really need to toughen up and just remind yourself of what you're getting yourself into, and how deeply passionate you are and how badly you want it. So yeah, that's that work experience. So there are, I'm just looking at my notes. Okay, so there are loads of different types of work experience. Oh, someone's joining. So there are different types of work experience. Work experience, I personally think, is the most important part of the application. Is when you get to learn the most about yourself, really. Yeah, you learn about the profession, but you learn so much about yourself and what you truly enjoy. I personally recommend getting work experience for any career that you really think of. I'm really grateful that I got work experience for medicine and dentistry, because it meant that going into dentistry, I really felt like I'd made the right decision and thought it through, because again, this is a lifelong commitment. And so you really want to just make sure that you feel like you're never going to regret that decision. So get as much work experience as you can, and don't be afraid to get multiple placements as well. Like, you don't have to only have like one placement and then go on to send your application up. You can do multiple placements if you feel like you're still unsure. Because I mean, a lot of my friends, when they did their work experience for medicine, they came into contact with doctors who tell them not to do it. And immediately after seeing that person, they just dropped out and said they don't want to do it anymore. So yeah, like, you can meet people who will really discourage you, but that's because that's their impression of their career, and that's how they felt. It depends on their character, basically. They felt like it wasn't right for them, but it was definitely wrong of them to put that same pressure on the people who were just trying to see whether the career was right for them. Because there are definitely people who really love what they're doing, and the majority of them do. The people who don't like what they're doing, they're typically louder than the people who love what they're doing. And so you might be hearing more doctors or dentists saying that they hate their job and stuff like that. Okay, so yeah, you've got different types: hospital placements, general practice placements, international placements, and volunteering. What you want to do is have a long-term volunteering placement. So I volunteered for 2 years at Watford General Hospital. I volunteered on wards, and I'd help feed patients and just talk to them in general. That was the most rewarding experience for me, because again, I learned the most about myself. But then I also had international placements and general dental practice placements. So my international placements is where I saw a lot of the crazy stuff, where they're definitely a lot more lenient with what you're allowed to see. And seeing that crazy stuff, I was still really motivated and absolutely loved it. I learned a lot about the skills in which each of these individuals have and what makes them so good at their job. And doing that with my long-term volunteering placement, I was able to try and emulate that. So to emulate that means you see the skill and you try and practice it to see whether, I guess, it feels right with you. And that volunteering, I would emulate that, and it would just feel amazing, and I absolutely loved it. So basically, I was volunteering after, say, a placement with a doctor, and then I'll try and be a doctor when I was volunteering, or just try and replicate some of their skills, like just the confidence in which they talk to people, the way in which they approach people, the way in which they care for people, or they're so caring for people. And for me, that really sealed it off, that emulating aspect. So yeah, the most important part is your volunteering and the placement, but you definitely want volunteering, because volunteering is more important than the placement. Now, obviously we're in a pandemic. So some of you are going into year 13, but the majority of you were in year 12 and a few in year 11. You want to get your work experience, your volunteering experience in year 12 or year 11, or just any stage where you're available. If you're over 16, you should be volunteering, really, if you're interested. And then get your work experience maybe in the summer of year 12, like your placement. That's how I did it, and I feel like that's the best time to do it. But obviously now, because of the pandemic, that's changed a lot of things. You guys probably won't be allowed in the hospital for another year. So yeah, what you can do instead is that there's so many other things you can be doing, and the medical schools or dental schools they'll be really understanding, and they don't expect you to have work experience now because of the pandemic. So you won't get penalized, but even if you can get work experience, it will be at your advantage, and it deepens. They might necessarily be impressed by it, and they won't give you any extra marks. It will come off in your confidence. It'll come across with your confidence and in the way that you talk about the profession. So yeah, work experience should really be all about you and you learning more about yourself, and not really trying to impress the interviewers. But yeah, in the pandemic, now that we've got a pandemic, there's still many things you can do. So don't be demotivated. I've put a few things down. Oh, I can see it, never mind. So yeah, I've put a few things. You can set up a call with a doctor or dentist. So I did that once. It was okay. I didn't gain that much from it, but then I still wanted to do more stuff. You can reach out to current students for advice. So I'm a dental student, and I'll probably leave my email. I'll put my email in the chat afterwards if you want to ask me questions. But yeah, you can reach out to me if you have any questions. Volunteering. Oh yeah, you can volunteer online. So volunteering at my hospital, Watford General Hospital, is still available. If you guys go and search up West Herts Hospital, there's only 7 of you, so they definitely wouldn't overwhelm them, and I'm quite confident you'll get a place. You can do that. I was volunteering over a month ago. I haven't been in a while because I was sick, but I saw a few year 12 students and year 11 students. There are loads of people your age volunteering. So definitely do that. Volunteering, as I said, is the most rewarding one, and is the one where you learn the most about yourself, and whether this is right for you. Yeah, you can volunteer online as well. I'm not sure how that works, but I know that at my school, they offered this phone call service where you could call patients, or yeah, basically call patients and just have a conversation with them. Again, that's something really rewarding. You'll just learn about whether you like being around people and whether you like talking to people. Virtual work experience. Okay, there's loads for this. I would recommend Medic Mentor. They have so many virtual work experience placements, but there are a few universities that do it as well. I feel like those will be quite difficult to access because as a university, it's going to be really popular and loads of people will be trying to go for it. So I'd recommend the Medic Mentor one. So yeah, probably write that down. They do dentistry as well for virtual work experience. But Netflix and YouTube, there's this one series, no, there's 2, Lenox Hill and A Surgeon's Cut. Those series are absolutely amazing. So as I've got on the left, the goals of work experience, one of the most important ones is to give you a realistic understanding of the physical and emotional demands of a career in dentistry and medicine. Those series are perfect for that. I didn't get to see that I didn't watch them when I was applying, but none of my work experience placements showed me how emotionally draining and physically exhausting. Okay, maybe dentistry showed me the physically exhausting bit, but no, and medicine as well. They made us walk around the hospital for like a week straight, but yeah, that shows you the best way. It's the clearest way. It's a whole journey, and I'd really strongly, in fact, it should be vital that you watch that series if you're confused. And I feel like that'd be a great first step. If you watch that and then you feel like you absolutely love what you watched, then you can start to think about volunteering and getting work experience if you can. YouTube, they've got loads of YouTubers. So as I said on one of my points, reach out to current students for advice. There are loads of YouTubers. Like I'm sure all of you guys have heard of Ali Abdal, but the smaller YouTubers are the best ones, I personally feel like, because they're just a lot more personal with their community. And so you really get to see what it's like being a med student or a dentistry student and at that specific university as well. Research programs, yeah, there are quite a few. So you can do, I forgot the exact word for what they're called. They're like an online series of lectures. I did this and I mentioned it in my personal statement and they absolutely loved it. But I forgot what it was called. But you can find some. You can probably ask your school as well. But yeah, that was amazing for me because I learned about dentistry, more about dentistry, because going into the application, I obviously had a surface knowledge of what dentistry would be like. I felt like dentists, I mean, everyone taught me all dentists do are clean teeth. And that was my impression. And that was what was honestly driving me to pursue medicine more at some stages. But as I learned more about dentistry, I realized it really was not just about cleaning teeth, and how I learned about how complex it is. But yeah, it's easy to believe that it is about cleaning teeth because we as younger people, we don't really have that many problems with our teeth. We don't go to the dentist and get sedated for full surgical procedure, or we don't go to a dentist for aesthetic treatment, those sorts of things. So yeah, you don't really get to see how rewarding it can be in that aspect if you're interested. But yeah, I think that's everything. And I put a website, I put a link to a medic portal in which gives you some work experience alternatives. But I feel like if you wrote down the things I said, and if you forgot what I said, you can ask me at the end. If you wrote down the stuff I said, that should be better because everyone's going to be using that medic portal stuff and it will be so competitive to get anything. So yeah. Okay, next slide. So it should last 10 more minutes. Why is this important? Yeah, so the most important aspect of work experience is the reflection. So as I said before, what you take away from it and not just what you see. So what you can do when you what you can do when you end up doing it. So if you're volunteering, is just at the end of the day, or at the end of your placement, just write down the stuff you saw. So for me, when I was doing my dentistry work experience, in the UK, I was shadowing a general dentist, and a lot of the stuff I saw was really repetitive, and a lot of the times I was definitely getting bored. And yeah, but then every once in a while we'd see a case where a patient might be screaming, and then I just see the dentist do absolute bits in general, and just to make the patient feel a lot less nervous. And that showed me the aspects in which I was really attracted to. And so I wrote down everything, just straight up, all of my feelings. And then later on, when writing my personal statement, I reflected more deeply on that. And I got to take out a lot of things from it. So actually, yeah, I think I've got my personal statement. Okay, I've got a sample of my personal statement on the next slide. So if you had a read of that, yeah, have a read of that. I'll give you like 30 seconds. Okay, I'm gonna assume you guys have read it now. So from this, if I had like a notepad while I was doing my work experience, and I just wrote down literally everything that I was seeing, it was honestly what was keeping me awake at the time, because it got so boring at times. And yeah, I wrote that down, and then I thought it was boring. I'll come back and go, I don't know how I felt about that. Then after I reflected on it and I realized and I saw deeply everything that was happening and how there was an entire skill set being applied that I wasn't aware of at the time. I picked up on that and I mentioned that on my personal statement. And in realizing that, that really, I guess, made me even more driven to pursue that career. And so you've got the emulating part with volunteering. So that's what I was talking about with emulating or trying to practice those skills that you saw. Compassion was the main thing. I learned how to practice, as well as communication and empathy, and patience, definitely patience, because I definitely had a lot of angry people. I met a lot of angry patients when I was volunteering. I learned how to, I guess, use those skills around people. And it felt so natural to me doing that. And yeah, that's what made me realize that, okay, it's definitely this career. So yeah, this basically shows the final outcome of or what your reflections can look like after you do your work experience. So yeah, and that's how it can look in your personal statement. Okay, next one. Choosing a school. So choosing a medical or dental school will be, yeah, these are the main things you want to consider. So the first three things, traditional, so the first three words I've got up there, traditional, integrated, and integrated, those are these types of course that each university in the country offers. It's the same for dentistry. Traditional courses are where it starts off with a scientific base. So the first few years are purely science with no clinical exposure. And then after that, you'd go and do, say, 3 years of straight clinics with much less of a focus on the science aspect. Integrated would be a complete mix of that. So dentistry at Cardiff, ours is integrated. I personally love integrated because we're doing all of that stuff at the same time. We're learning about the science of the body really intensely, but then after that, like maybe the next day, they'll pull us in for cadaver dissections and stuff like that, and we study the anatomy of the entire human body. And then after that, we'd have a practical in a lab, a chemistry-based practical, those sorts of things. Whereas traditional will be separated and split within the years, I guess. Now, the reason why people go for traditional is because they really want to get a scientific foundation before they go into work in the hospital. And to do traditional, you have to really enjoy your science. And you have to be keen on going to the absolute maximum for the sciences and writing loads of essays. So I think it's only Oxford, Cambridge, and Queen's Belfast for medical schools that do traditional. Yeah, but I feel like anyone who, yeah, you just have to be motivated by the science, but you still will have a really large scientific application in integrated learning. It's just, I guess, at a slower pace and spread out over 6 years or 5 years, whereas traditional is just 3 years first, and then the rest is all clinics. Integrated is where you can take a year out. So if you're doing a 5-year degree, you take a year out and you focus on something else entirely. So I know someone who went to KCL, did medicine. I think maybe on their 3rd year, they took a year out and focused on sociology, I think. And they got, I'm not sure, maybe I think you'd call it a title from that, or with a degree in that. And then they went back to do medicine and completed their degree. And so they graduated with something in, I'm not sure what it would be called, maybe a bachelor's in sociology, but also in medicine. So MBBS is what you'd say for medicine. So yeah, if you're interested in doing medicine, but you also want to pursue or just learn about other things just out of fascination, that would definitely be for you. I'm definitely considering it because I'd love to learn more about, or just take a step away from the sciences for once, because I've definitely been focused on the sciences my whole life. I'd love to learn more about how the world works in general. So yeah, if you're into that kind of stuff, integrate would definitely be for you. Compare the entry requirements. What do I say for this? Okay, so these entry requirements are mainly like your GCSEs and your A-levels. For A levels, you need to do biology and chemistry, simply. And if you're not, you should really strongly consider dropping one of your A levels and picking up either biology or chemistry. Chemistry is vital, or chemistry is essential within every university. You wouldn't be able to apply to university without chemistry. Biology is not essential in that way, but I don't understand why anyone would go into a career in healthcare without biology, because you will just struggle at university. And yeah, my understanding of the understanding that A-level biology has given me before I went on to university has helped me so much. There are times where like I can completely skim through a lecture because we went into so much detail in that topic in biology, or at A-level, I already like researched beyond a bit because I was doing that for biology. So yeah, you definitely want biology and chemistry. Your third A-level can be anything. Someone gave me advice to stick to the classic A-levels, like maths, physics, English, those sorts of things, and not pick something like general studies, or what do they say here? Well, actually, general studies doesn't count as an A-level if you're applying for medicine or dentistry. But yeah, just stick, and I would say that as well, stick to the classics. Pick maybe a science or maths or English, but that's just my personal opinion. Because when you get to university, I feel like those core subjects, they give you such a great foundation for when you get to uni. And that's really the whole point of A-level, to just give you a foundation before you get to university when it gets really, really hard. So yeah, shortlisting policies. Okay, so if you apply for dental school or med school, obviously there are tons of applications, and I'll say this happily, dentistry is more competitive than medicine. I think it's like 17 applications per place, whereas with medicine it's maybe like 10. It's around that. I'm not sure of the exact figures, but yeah, dentistry is more competitive, and as a result of that, that means they use things like shortlisting. I mean, they're both intensely competitive, more competitive than any other degree. So they do shortlisting, or shortlist candidates based on their application, based on their GCSEs, based on their A-levels, based on their UCAS scores, so the entrance exams, and BMAT scores as well if you want to do the BMAT. And they'll basically set a cutoff is what that means. And if you don't score a certain amount in your UCAT, they'll just reject you straight away. If you don't get AA at A-level, they'll reject you. If you don't have an A* in all three of your sciences, they'll reject you. So that's what a cutoff is. And that's what shortlisting policies are. Oh, your personal statement as well. They use your personal statement in the interviews to narrow down on who they feel would be the extremely suitable candidates out of everybody that hasn't been cut off. And so your personal statement is really where you want to shine. But when people would tell me that when I was applying, that would just make me feel really nervous. I didn't feel like I could shine. But what your personal statement should actually be is just an opportunity for you to show who you are, to yourself, but to give a sample of yourself and who you are to the person who's going to read it. I want to say something really good, but I just forgot. But yeah, just give like a sample of who you are. Oh, and to reflect it really deeply on all of your experiences so far. The main thing that they want in your personal statement is to see that you're someone who can reflect. That's the most important. Yeah, that's like the biggest thing in your personal statement, the reflection aspect, because you would have spent 2 years straight, around 2 years, building up this application. And in your personal statement, you're going to have to reflect on all of that and summarize it down into, I think, 2,000 characters. Maybe it was 5,000, I can't remember, something like that. Or just on a single page, really. And then the interviews, obviously they use that to just refine it down or narrow it down even further, and grow you some more. Yeah. Okay, so some might expect you to have work experience. So the requirements for work experience at each university differ. As I said before, they're going to be really lenient on it, and they won't expect you to have work experience right now. But they will expect you to have done something that still shows your commitment to the field that you're looking to pursue. Yeah, that's everything. Oh no, location as well. So open days, go to as many open days as you can, because that was definitely my biggest regret. I personally relied on the fact that I was confident I was going to get interviews, and so I relied on my interviews to learn more. Or like when I went to the university to perform my interviews, I relied on that to learn more about the university. But I definitely don't recommend that, because when they ask you things like, what about this university do you really, really like? You want it to be a genuine answer, and you don't want it to be something that you read online, or like you saw that, oh, they have a basketball club, and so you want to join that. That's exactly what I said. But I wish, like, if I'd gone there, I would have been able to give a much more genuine response. And yeah, so go for as many open days as you can. Oxbridge. Okay, so if you're looking to apply for Oxbridge, well, we've actually got a few minutes over, but we're almost done. Yeah, we're really close to finishing. If you're looking to do Oxbridge, I have to read this straight out because I don't know too much about it. But Cambridge requires 3 A stars at A level and predicted grades. Oxford requires A star AA. And for both of them, you have to do the BMAT. Yeah, so they use your BMAT and your GCSE performance to rank each applicant as to whether or not they'd get an interview. But Cambridge has almost twice as many places for medicine in comparison to Oxford. So yeah, you might want to take that into consideration. So that's just that, we can skip. Teaching styles, I'll go over this quite quickly. Traditional, that's obviously where you have science first and then clinical. Problem-based learning. Problem-based learning is like, well, yeah, so you want to be choosing your medical schools based on what teaching style you feel suits you the best. Problem-based learning, case-based learning, and inquiry-based learning, they're quite similar. Or inquiry-based teaching and case-based teaching, all of that, they're quite similar. Problem-based learning is the really independent one though. It involves a lot less lectures, and essentially you'll be given a problem and you'll be split into groups, and you'll be told to investigate and learn as much about that problem individually within your group, and then come together again and present that to one of your tutors, showing your findings. And that's how that course would be based. Now, the reason as to why they do this, me personally, when I first heard of problem-based learning during my application, I thought it was dumb and I'd never want to do that, because it meant that we'd have to rely on everybody in the team to be getting the work done, and there might be individuals who in that team may not be consistent and things like that. But it was also that you'd obviously divide the workload amongst yourself, and I thought that meant I wouldn't be able to learn everything about the case. I'd only learn like a section of the case, because I would have been told to focus on that section. And so overall, my overall knowledge of that case would be quite vague. But that's not necessarily the case. Problem-based learning is probably the best way to prepare you for medicine. I would disagree. I would say I don't think it's good for dentistry, in my personal opinion, but for medicine, I think it's the best way to prepare you for medicine and what life would be like in a hospital. Because when you get to hospital as a doctor, you start off with your ward rounds, you meet with all the other doctors, and you talk about the cases, and you decide how you're going to deal with this case, and you each contribute your knowledge and find a solution as to how you deal with that case or how you deal with that problem. So that's, yeah, problem-based learning really prepares you for that. It prepares you for working in a team. It prepares you for communicating really well. And yeah, it's really good if you're looking to do medicine. So if you feel like you're someone who's comfortable with working in a team and yeah, just comfortable with working in a team and you love working independently, you don't feel like you want to be doing many lectures, problem-based learning should definitely be something you consider in the university you want to apply to. Case-based teaching, I think, yeah, this is what we do at Cardiff. So case-based teaching, they present you a case. Your tutor will teach you loads of stuff about that case, but then you also have to go away and learn more information about that and then present something at the end of that to the tutor to show them how much you've learned about that individual case. And yeah, inquiry-based teaching, that's quite similar to case-based teaching, and I won't go over that. Yeah, basically the same thing. Entry requirements. Okay, so GCSEs, the entry requirements vary for GCSEs and A levels. I'm sure you all know that for A levels, it's mainly 3 A's for most universities, and some universities will go for A star, 8A. And Cambridge is the only one that I know that does 3 A stars. For your GCSEs, they typically want you to have done 3 sciences. Most applicants will have a really strong set of GCSEs, and I'm talking like maybe 6 to 10 A stars, with everything else that's not an A star, an A. And if you don't have that, that's completely okay. But there are students who would have bad sets of GCSEs and have all A stars at A level. So yeah, if your A levels are really good and your GCSEs aren't that bad, are bad, then you shouldn't let that discourage you. A levels, as I said, you need biology and chemistry, because if you don't do biology, you'll struggle quite a lot at university. Admissions tests, you've got the UCAT and the BMAT. The BMAT, we go into all of this in a lot more detail in the future sessions, but the BMAT, people typically discourage you from, or most people, when I was looking to do the BMAT, they discouraged me from doing it because they said the BMAT is the harder one and the UCAT is way easier. You don't have to do as much prep for it. But I say that isn't true. I feel like if you're someone who enjoys learning and enjoys the science, then you'd probably love to do the BMAT. There's a lot more of an exam format, and I feel like I personally would have performed a lot better in the BMAT if I did it in comparison to the UCAT, just because it fits well with the way in which I like to learn. So yeah, don't let people's opinions of that dissuade you from doing it. Age, okay, you have to be 18, and then A-level resets. No resets are allowed basically in all of them. But for my year, because of the pandemic, while A-levels got cancelled, we were allowed to reset and reapply if we didn't like the results we had. So yeah, now we're done. Okay, 1 hour and 10 minutes, that's not bad. Q&A, so if you guys have any questions, ask them now. I'll put my email as well if you want to ask. But yeah, if you have a question, it's most likely that someone else is also thinking that same question. Okay, I just put my email in the chat. Is there a link to the hearts thing? I can give you their email if I check. There we go. I was pretty quick at that. There's their email. Now, if you're looking to like pursue that, I would say you just email them and say, hi, I'm in the year 12 and I'm really keen on pursuing a career in medicine. I've done a lot of research into the volunteering opportunities that you offer, and I'd really love to experience this and help you guys out volunteering on wards. How might I be able to go about doing this? And they would respond with, oh yeah, sure, fill out this form, blah, blah, blah. It might take you like a month or two to get in, but yeah, I've given you that direct email. I'm not sure what the website might say, but I think, yeah, I'm pretty sure that's the direct email. So they should respond to you and they'll be quite kind and it should be quite quick because you've done it by email. But questions? Okay, I'll read this out. For work experience, should it mainly be medicine or dentistry based, or should we also do other things such as tutoring, which would also provide different skills that can be used in medicine? That's a really good question. I'd say do as much work experience as you feel like you want to. Again, you don't want to be trying to impress the you don't want to be trying to impress the interviewer. You just want to be learning more about yourself. And if you wanted to do something like tutoring on the side, that would be that, I guess, that aspect in which you can emulate what you're going to be seeing on your placements. So you want something that will be, you have a placement and then you have something where you can emulate those skills, where you can practice those skills yourself. So yeah, have one thing for either entirely medicine, and then have another thing that would be for you to practice that, or just that's something that exposes you to other people. I think tutoring would be great. Yeah, I think tutoring would be really, really good, because teaching is one aspect of, is one of like the core, so one of the pillars of any career in healthcare, that you have to be able to teach your patient what's going on with them or what's wrong with them. So yeah, you gain so much from teaching, and if you enjoy teaching, you can talk about how much you enjoyed that in your personal statement. So yeah, that would be amazing. But yeah, get as much experience and as many placements as you can until you feel that you're completely sure of what you're going into. And then yeah, just write as much down as you can from what you saw on the day, and then you can reflect on that later and turn it into an amazing personal statement. So yeah, that was a really good question. I hope I answered that okay. Any other questions? Okay. I'll assume that's the last one. If you have questions that you just didn't think about at the time, but you want to send me later on, just email me. I'll send a reply back as fast as I can. But yeah, I'll see you guys next week. We'll be working on a UCAS application and a personal statement. And we'll go into a lot more detail about how you can use your work experience and turn it into a really good personal statement. So yeah, I'll see you guys next week. You can go now. Bye. Yeah, they should upload it to YouTube. I'm going to send it to them, and they might upload it to the YouTube channel soon. So yeah, you can watch it back and make notes on some of the stuff that I said. All right. Thank you guys. I appreciate your messages. All right. Bye then.